Let's review. Pathology. Our category for this video is 100 Most Common according to Robbins. Are you ready? Good luck! Most common cause of cell injury in clinical medicine. Ischemia. Most common stimulus for hypertrophy of skeletal and cardiac muscle. Increased workload. Most common epithelial metaplasia. Columnar to squamous. Most common exogenous pigment that accumulate in cells. Carbon. Most common mechanism of vascular leakage in inflammation. Contraction of endothelial cells resulting in opening of interendothelial gaps. Most common cause of defective inflammation. Leukocyte deficiency. Most common cause of peritoneal effusions or ascites. Portal hypertension. Most common manifestation of heparin-induced thrombocytopenia. Thrombocytopenia. Most common autoimmune disease associated with antiphospholipid antibody syndrome. Systemic lupus erythematosus. Most common site of arterial thrombi. Coronary arteries. Most common site for venous thrombi to develop. Veins of the lower extremities. Most common form of thromboembolic disease. Pulmonary emboli. Most common autosomal recessive form of Ehlers-Danlos syndrome. Kyphoscoliosis type. Most common form of GM2 gangliosidosis. Tay-Sachs disease. Most common lysosomal storage disorder. Gaucher disease. Most common clinical subtype of Gaucher disease. Type 1. Most common known genetic risk factor for development of Parkinson disease in patients with Gaucher disease. Mutation of the glucocerebrosidase gene. Most common hepatic form of glycogen storage disease. Von Gierke disease. Most common of the chromosomal disorders. Down syndrome. Most common cause of trisomy. Meiotic non-disjunction. Most common type of acute myeloid leukemia associated with Down syndrome. Acute megakaryoblast leukemia. Most common sex chromosome abnormality in females. Turner syndrome. Most common cause of male sterility. Klinefelter syndrome. Most common genetic cause of intellectual disability in males. Fragile X syndrome. Most common type of DNA polymorphism. Single nucleotide polymorphism. Let's take a break. Challenges are what make life interesting. Overcoming them is what makes life meaningful. Joshua J. Marine. Back to the test. Most common pattern of glomerular disease in systemic lupus erythematosus. Diffuse lupus nephritis. Most common disorder associated with Sjogren syndrome. Rheumatoid arthritis. Most common organ involved in scleroderma. Skin. Most common complement protein deficiency. C2 deficiency. Most common form of severe combined immunodeficiency. X-linked. Most common cause of autosomal recessive severe combined immunodeficiency. Deficiency of the enzyme adenosine deaminase. Most common infection associated with X-linked lymphoproliferative disease. Epstein-Barr virus. Most common mode by which HIV is spread globally. Heterosexual transmission. Most common type of HIV associated with AIDS in the United States. HIV-1. Most common neoplasm in patients with AIDS. Kaposi sarcoma. Most common fungal infection in patients with AIDS. Candidiasis. Most common neurodegenerative disease caused by HIV. HIV-associated neurocognitive disorder, or HAND. Most common form of amyloidosis. Primary amyloidosis. Most common form of familial amyloidosis. Familial Mediterranean fever. Most common cancer associated with reactive systemic amyloidosis. Renal cell carcinoma. Most common organ involved in amyloidosis. Kidney. Most common pathway for the initial dissemination of carcinomas. Lymphatic spread. Most common cancer of men in the United States. Prostate cancer. Most common type of abnormality involving proto-oncogenes in human tumors. Point mutations of RAS family genes. Most common mutated gene in cancer. TP53. Most common type of chromosomal rearrangement that can activate proto-oncogenes. Chromosomal translocation. Most common translocation in Burkitt lymphoma. Chromosome 8 to chromosome 14. Most common endocrinopathy. Cushing syndrome. Most common paraneoplastic syndrome. Hypercalcemia. Most common humoral factor associated with paraneoplastic hypercalcemia. Parathyroid hormone-related protein, or PTHrP. Let's take a break. Perseverance is not a long race. It is many short races one after another. Walter Elliott. Back to the test. Most common lung neoplasm associated with hypercalcemia. Squamous cell carcinoma. Most common cancer associated with acanthosis nigricans. Gastric adenocarcinoma. Most common and efficient mode of microbial dissemination. Through the bloodstream. Most common extrasalivary gland complication of mumps. Aseptic meningitis. Most common clinical presentation of non-tuberculous mycobacterial infection. Chronic pulmonary disease. Most common bacterial sexually transmitted infection in the world. Chlamydia trachomatis. Most common fungal endocarditis. Candida endocarditis. Most common pathogenic species of Aspergillus. Aspergillus fumigatus. Most common route of entry of mucormycotina into the body. Inhalation of spores. Most common opportunistic infection of the central nervous system in AIDS patients. Toxoplasma encephalitis. Most common manifestation of drug-induced hypersensitivity. Skin rashes. Most common analgesic used in the United States. Acetaminophen. Most common cause of acetaminophen toxicity in Great Britain. Intentional overdose. Most common acute effects of cocaine in the central nervous system. Hyperpyrexia and seizures. Most common infection among heroin-addicted persons. Viral hepatitis. Most common cause of thermal injury. Burns. Most common bacteria in burn tissue. Pseudomonas aeruginosa. Most common hyperthermic syndrome. Heat exhaustion. Most common cause of oligohydramnios. Chronic leakage of amniotic fluid due to rupture of fetal membranes. Most common genetic etiology of congenital malformations. Multifactorial inheritance. Most common developmental defect of the forebrain and midface in humans. Holoprosencephaly. Most common cause of respiratory distress in the newborn. Respiratory distress syndrome. Most common cause of early onset perinatal sepsis. Group B streptococcus. Most common cause of early onset bacterial meningitis in the newborn. Group B streptococcus. Most common form of phenylketonuria. Classic phenylketonuria. Let's take a break. Testmanship tips. Answers with the following words are usually correct. Seldom, generally, tend to, probably, usually. Adapted from Study Skills and Test-Taking Strategies for Medical Students by Deborah D. Shane. Back to the test. Most common lethal genetic disease that affects Caucasian populations. Cystic fibrosis. Most common CFTR mutation. Class 2 at amino acid position 508. Most common cause of infertility in cystic fibrosis patients. Congenital bilateral absence of the vas deferens. Most common finding in patients who died of sudden infant death syndrome. Multiple petechiae. Most common teratomas of childhood. Sacrococcygeal teratomas. Most common tumors of infancy. Hemangiomas. Most common extracranial solid tumor of childhood. Neuroblastoma. Most common location of neuroblastomas. Adrenal medulla. Most common primary renal tumor of childhood. Wilms tumor. Most common cause of left ventricular hypertrophy. Chronic hypertension. Most common etiology associated with ascending aortic aneurysms. Hypertension. Most common etiology associated with thoracic aortic aneurysms. Hypertension. Most common cause of death in aortic dissection. Rupture. Most common manifestation of drug hypersensitivity vasculitis. Skin lesions. Most common form of vasculitis among elderly adults in the United States. Giant cell arteritis. Most common organ affected by Raynaud phenomenon. Extremities, particularly fingers and toes. Most common cause of lower extremity deep venous thrombosis. Decreased blood flow in the setting of prolonged immobilization. Most common agent causing lymphangitis. Eta hemolytic streptococcus. Most common type of hemangiomas. Capillary hemangiomas. Most common form of vascular ectasia. Nevus flammeus, or birthmark. Most common location of glomus tumor, or glomangioma. Distal portion of the digits. Most common underlying etiology of diastolic failure. Hypertension. Most common cause of right-sided heart failure. Left-sided heart failure. Most common known genetic cause of congenital heart disease. Trisomy 21 or Down syndrome. Most common congenital heart defects to be diagnosed in adults. Atrial septal defects. How did you do? If you find this video useful, consider giving this video a like. Your support greatly helps this channel. Remember to click the subscribe button so you will be updated of future review videos like this. Study hard, and see you on the next review video.